Good afternoon. And today we have a very special program because we have a pleasure to interview Nicole Tabun. She's certified orofacial myologist, and her patient, Nilda Taveras. We're going to learn about collaboration between several areas and also the relationship between practitioner and patient, how the whole treatment happens. So this is actually a testimony in the shape of interview, how this treatment can change the life of the patient. And thank you very much to my audience. If you someone who have a trouble sleeping or sleep next to snoring partner, this program is for you. We're going to show you the different way to approach this problem. And if you're a medical professional who, just like us, so passionate about putting a little puzzles together to find the best possible way to treat your patients and bring them, happiness and health, this program is going to be for you. Now, I want to talk a little bit about Nicole. Nicole is my friend. She's a leader of the community I belong to, Tri-State Myology, Tri-State, let's call it. And she also had a experience, many years of experience of being dental hygienist. She has a great education, and on top of it, she's certified trained craniosacral therapist and certified orofacial myologist, and she practiced in Westchester in New York State, and you can find her online. And she's also on a board of International Association of Orofacial Myologists. And my first question going to be actually for our patient, Nilda. Nilda,
Right.
Tell us, what was the problem? What brought you to Nicole?
Sure. So I suddenly developed mouth breathing at night, which was really bothersome. And I tried to get to the root of it. I saw an ENT and so on, but nothing was really helping. And so one of the last things I saw was myofascial therapy. So I thought, let me try that. I found Nicole. And from the first assessment, it was obvious to me that this was absolutely a missing critical link in my path. Prior to going to Nicole, one of the reasons I did book her is because as I was trying to fix my breathing pattern or even understand how to breathe properly, how to breathe in my diaphragm, for example, I was noticing that I clenched my throat and I had trouble just like allowing the breath. And then I noticed that my tongue just didn't have a home. It didn't know where to be. And at night when I was sleeping, as I was falling asleep, I felt it slide back and kind of block my throat, which made me realize that I definitely have a tongue problem. And I knew I had a breathing problem because I just couldn't understand even simple, like breathe into your diaphragm. It was, so when I went to Nicole, it was very clear from the first meeting that this was an absolute critical missing piece, that I could continue on and on. Without this, I don't think I would ever progress.
Tell me, Nicole, like we saw it through the eyes of Nilda, but from your eyes, what did you see when Nilda approached you? And it's so interesting, like she realized what she all of a sudden developed mouth breathing.
Yeah.
I want to see that from your point of view.
Sure, thank you. So with Nilda, again, she presented with the classic case of my tongue does not have a home, as she perfectly put it. I am mouth breathing and I don't know how to overcome this. It's something that developed, and it developed actually during the pandemic from being masked. It's something that made it difficult for her to sleep. And then we got deeper into the other issues that she was facing throughout her body, which core instability, pelvic floor issues, a rotated hip, body posture that just never felt stable for her. And so as we started to peel back the layers of that onion, it was very clear and obvious that it truly came right back to her mouth and the dysfunction that was happening with her improper tongue placement and her breathing habits.
That's absolutely great how comprehensively you approach Nilda. But my question to you, Nilda, it's so wonderful. And I talk to my patients about how tongue and pelvic floor health so related for females. You know, it's so
Yes.
critical for us as a females. So tell me, when pelvic floor instability, what exactly you sense?
Okay, so I had 2 babies, and so every person I went to attributed all my issues to having had a baby. And one of my physical therapists did tell me that because even the bottom of my foot, I didn't have like the arch. It was all like the whole line, right? And so she said to me, and I always stuck in my mind, that the arch of the foot, the pelvic floor, the rib cage, and the tongue were all like domes. And she told me that, and it always stuck in my mind. I could not understand what she meant at all, but I did know that I had come across other things talking about tongue posture before. I never thought it was relevant to me, but then it did feel very relevant because I didn't really have an understanding of it. What I felt in my pelvis was a lot of tension. It really, I was putting a lot of strain on the wrong muscles. And I'm still in correction mode, but I'm way better now. But it really came as glute muscle tension. I just didn't feel very stable in my pelvis. So I was always gripping, especially the front of my hips. And I have trouble like putting weight all the way through on my left foot. So that's kind of what I went to Nicole. That's why she said I have like a rotated hip, is because I was so dysregulated and my body was just trying to compensate in all these odd ways. Which is why when I went to physical therapy, I presented as just kind of like a strange, mysterious entity, because all these parts of my body were just tight. Anywhere they touched it, like, oh, this is tight, this is tight. And I knew that I didn't feel loose. The only time I felt some relief was when I started to kind of notice or get the sense of breathing. Because one of the things they try to encourage was for me to feel my pelvic floor lifting and descending. And it wasn't really doing that because I was so tight. Tight, I realize now, because my tongue wasn't helping. Everything was out of alignment. And so my pelvic floor was just like holding on for dear life.
Yes, I want to ask you, Nicole, from being trained as a craniosacral therapist, and when you evaluate Nilda, I understand with the tongue position, but what did you see and what did you do as a craniosacral practitioner to add to your myofunctional therapy? Can you talk about those impacts?
Sure. So probably after a handful of times, Nilda and I worked together on tongue posture, incorporating Buteyko breathing method to really get her to get out of that clavicular breathing and down into her diaphragm. Part of me was like, I feel like the fascial tension has to be there. We all know that deep front line of fascia from our tongue to our toes, and there is a direct connection between the tongue and that pelvic floor. And so I wanted to kind of tap into that. So I did a 10-point session where, as a craniosacral therapist, you go down all the systems and you trace that fascia, you see where it's kind of bunched up or kinked up, and you try to move it and dissipate it and get it out of the system so other things can function. And so I came across a lot of things, Nilda, that in that 10-point inspection. I think there's 3 things that stuck out to me. And one was my investigation of where is her sacrum sitting, because I felt like it was definitely stuck. And sure enough, her sacrum was stuck off in that pelvis towards the left. And it took about 2 sessions to get that to drop nicely into my hand. And In doing so, it relieved a lot of tension in the hips, and it helped Nilda to stay in her better posture while standing. Working on the occiput at that cranial base and elongating the back of her neck, Nilda said, I feel like a giraffe because my neck has never felt so long and stretched in my entire life, because there's always that compression, right? We think of low tongue posture. We think of mouth breathing. That brings our head forward of the spine. We're putting all that compression and pressure on the spine. And so pulling that occiput up and off those C2s was really a good feeling for Nilda, as well as releasing that hyoid. One of the last times I did a hyoid release on her, she actually felt it right down in the left side of her pelvis. So what I was doing here was loosening up tension right in her pelvic area.
Can you give us a little, practical tips or show us how you actually release hyoid bone for Nilda? Because I'll tell you this, I was in a museum in Dallas and they talk about very sad topic of the funeral tradition in Japan. So hyoid bone, because it looks like Buddha, it's the most sacred bone for Japanese people, and they're searching for that through whatever funeral traditions to find the hyoid bone, most important bone. So it stuck to me how important this bone is, and it's actually holding the tongue. So what did you do to release this hyoid bone?
So remembering with craniosacral therapy, it is a very light touch. It's about 5 grams of pressure, where you are actually working with the patient's inner physician. So there is this higher level of understanding of communication between your patient and yourself. And in touching, and we all know that hyoid bone is sitting right here at that thyroid, so we have to tread lightly in any case, but just holding on to that hyoid and finding the 2 heads of that bone, swallowing, gripping onto it with, again, just that light 5 grams of pressure, and feeling for its rhythm from that cerebrospinal fluid that is pumping out and giving each of our systems a rhythm. And hers was very off kilter. It was shaking and rocking in my hand like this. So what I do is hang on to that rhythm. I catch it and wait for it to almost fight its way out of my hold. I let it go. I check it again, see if it's in rhythm. If it's not, go back again. And you'll notice the changes happening with your patient. Again, that energy transfer and that inner physician back and forth conversation where there's a swallow. So saliva is being produced. The systems are kind of kicking into place. That whole nervous system is readjusting itself. Even you'll hear digestive sounds happening, a sigh of relief. And Nilda experienced a lot of those things.
Fantastic. So Nilda, I'm going to ask you what exercise you did to get from clavicle breathing to diaphragmal breathing. That's the breathing what's gonna support your pelvic floor and make you feel more stable. So what exercise you did to reach that, desirable outcome?
First, Nicole told me you cannot breathe through your mouth, and so the challenge of just keeping my breathing to just nasal breathing, that was a tremendous challenge. And I remember about 2 weeks in, I was in the kitchen just doing my thing, and then I caught myself mouth breathing. I thought it was just at night. Here I was during the day doing it too. And so I kind of doubled down on my noticing of my nasal breathing, just making sure. And once I was doing that, the other directive Nicole gave me was to check my tongue and make sure it's sort of like resting behind the 2 front teeth, as opposed to like jamming in a corner like it was when I first met her, or just like hanging out, without a home. And so putting attention on those 2 things, and already knowing that clearing my tongue from my throat made way for my breath to kind of like travel deeper. that was the first thing. And then with the diaphragmatic breathing took more time. Nicole gave me the Buteyko breathing exercise, which was challenging, but my body would start to kind of like figure out what it needed to do in order to achieve this. And what it needed to do was sort of like control the breath lower. You know, I was a very big chest breather, but Buteyko doesn't accommodate for chest breathing, you know, and so my body would eventually just kind of like drop it. I would say that's been a process. I would even say that this week I feel so much that my breathing is now mostly, you know, diaphragmatic. I barely catch myself in my chest anymore. So that's been a process.
So I'd like to just to do to make it clear for our audience, when you breathe, you actually travel with your breath down towards your navel, I would say.
Yeah, I make sure that it's nose breathing, and that I allow it to, you know, like you were talking about the hyoid. So one of the things I would do is I would clench here. So with a relaxed hyoid, it's very easy for the tongue to kind of sit in posture and for everything to relax down. And so I do feel now when I breathe through my nose that it goes all the way down, like all the way through my pelvic area. And it feels very soothing for my nervous system.
Got it. And I would like to ask you, Nicole, the question, because I know you, different from a lot of practitioners, work in collaboration with speech and language pathologists. I want to have insight of that collaboration. We have one pathologist we both know, Emilia Delpino, but you know how speech and language pathologists who work in a similar area with myofunctional therapists actually different first. That's a different entity. You know, some of them train in myofunctional therapy as well, but what's so different between speech and language pathologists and myofunctional specialists, but how these two specialties can complement each other and people of those two specialties can work together?
Sure. So we are so lucky to work with people like Emilia Delpino. Again, not only is she a colleague, she's a very dear friend of mine. We took our training together for orofacial myology many years ago, and we've collaborated on cases with her. We have two speech pathologists that are within our practice as well. And what I find is it really depends on where you got your training and where you went to school as a speech pathologist, because that's what you take, you know, you hone and you bring it along with you after you're done with grad school. And a lot of the time, or most colleges don't offer much about oral motor and oral dysfunction, or it's very gently touched upon. So again, fortunately, in our experience, we have come across so many wonderful speech and language pathologists in the area that we work with, and we're all very happy to bring what we know to the table, and that's the conversation we have. It's not about you're going to do this better, I'm going to do this better. It's how do we both do better for the patient to be better. And so what I would do different as a certified orofacial myologist, I'm truly looking at muscle function and dysfunction, breathing patterns, and habits, right? So all of these things can negatively and positively influence the orofacial complex. I'm not interested in speech sound production, even though it is something I look at, because you do have to figure out, could this person benefit from speech pathology, or do we need to push them in a different direction with their speech pathologist by having this open dialogue to say, this is what I'm seeing. If you're having a challenging time working on that, then I will work on these muscles to help support what you're trying to achieve. And it really truly is like a marriage, and we can't do it without one another, honestly. And again, I'm happy to be in the space that I am with these strong and wonderful relationships with the speech and language pathologists that we work with. I think our list is somewhere between 25 and 30 that we work with.
Wonderful. So
Mhm.
I'm going to ask the most challenging question of this interview. Tell us, Nilda, what keep you to stay motivated and move on through the therapy, like keep going? Because I know personally a lot of people who I recommend myofunctional therapy, and they start, and we had such a great intention to help them, but then in the middle, maybe we didn't have some secrets to keep them motivated. So please share what keep you going, Nilda.
I was convinced that there was an issue. So I wasn't wondering whether this was really something I needed. I could tell that it was. The exercises were very challenging. Another source of information. If it's hard, it means I need it. And then I also saw progress. I mean, the main thing is that I saw progress. And Nicole also was very helpful because she kind of kept me like focused, and there was progress, and she was like moved me along so it didn't feel stagnant. And yeah, she kept it interesting in that way. So it was challenging. It kept moving. And even now, you know, she always finds more stuff for me to do just to continue honing in. The posture, I feel improvement there. I feel improvement in my breathing. So I just have, I feel better. How about that? You know, so that's my motivation to keep going.
So tell us, Nicole, what, you know, like Nilda expressed it so well, but share your secret, how you register patient progress, what patients keep going through the course of therapy.
Sure. So again, since I am so collaborative, and I do truly look at my patients as a whole picture and not just their mouth, it helps me to build them the exercises and the recommendations and referrals that they need to get to where they want to be. Because unlike working with children, adults are in a chronic state, unfortunately, when they walk in my door. And I think if after 2 or 3 visits, you have someone who is no longer having headaches, no longer feeling discomfort in their neck, and feeling good, it's easy to keep them going. But you can only do that by really looking in a broad lens at everything and not just focusing on the one thing they came to you for.
This is wonderful. So last question, what I really find very hard in my practical life, because I'm trying to convince medical doctors that myofunctional therapy can really work for adults. So that question for both of you, do you find myofunctional therapy can make people healthier in any age?
Yes, at any age, because disease goes across the lifespan. And as if we don't pick it up early on, I've had so many adults tell me, why, if someone figured this out when I was a child, or why didn't someone figure this out when I was a child, then maybe I wouldn't be here in this chronic state of feeling unhealthy and unwell. So that's how I look at it. We can't just write people off that are complaining. We have to dig and uncover all of it. And again, we know systemic health stems from oral health. And if we are not breathing the right way, we are not using our craniofacial muscles the right way, everything else unravels under it over time.
Thank you very much, Nilda. Thank you very much, Nicole. And for my audience, you can find Nicole through her website, Nicole Tabun, and you know we're gonna have it in the comments. And also, she's a board member of International Organization of Orofacial Myologists. You can find her through that organization as well, and on Instagram. And she can really help you on a lot of levels, digging deeper into your health. So thank you very much.
Thank you, Dr. Sokolina. Thank you,
Thank
Nilda.
you. You're welcome. Thank you.